The first thing, let me just emphasize that if we're going to ask anyone in America, whether it's an individual or a company, to close down or to lose a job because we want them to distance so that we can stop this pandemic, we have to understand that we have to take care of them. If you're the single mom who's a waitress at a restaurant that closes down and now you've got 2 kids at home and you don't know if you can feed them, you don't know if you're going to have a roof over your head, it's incredibly important that we support them. I don't know a small business owner that doesn't want to do the right thing, but if they're hanging on by a thread. So right now, to really be most impactful in terms of trying to reduce the transmission, we need people's cooperation. The way that's going to happen if we actually have the support to make that possible for them to do that. And I think that's a major gap right now in many of these closings or other kind of forced activities we're asking people to do.
Michael, much of Europe went into lockdown except for schools in late October to control the surge, and it's largely working. There was a detailed report this morning on The Daily from the New York Times. Last week, you walked back your own suggestion of a shutdown here, a short one. Why?
Well, actually, I didn't walk it down. Actually, I walked it back. I never recommended it. It was a reported error on CNBC's website that said that I said that. I didn't. I laid out in August a argument for why we had to do more to actually, in a sense, lock down that virus then, but with financial support. And without that, you couldn't do it. And so I've been, just as I just stated, very clear to say you won't be really very successful if we don't provide that financial support. Do I believe, like Tony, that we need a set of national standards to help governors to know what to do that would be really effective? I mean, I'll give an example why I realize people are trying to reduce the transmission of the virus. I don't think we have any data that says closing the bars at 10 is that much more helpful than not closing them at all.
But there's data that shows that closing them down completely helps. We found that in New York back in the day. We shut the whole place down and it worked.
And that's exactly right. I agree with that. That's what I'm saying. So I think that what we're trying to do is understand what will make a difference. The economy will shut down on its own if we see this uncontrolled transmission. If our healthcare facilities start to fail, if people begin dying in emergency room waiting rooms after 10 hours of waiting to get a room, you're going to see people then at that point refusing to go into public at all. And then that's what's going to really
So we have to see a bunch of people dying? Because, I mean, there is another way. I mean, look at what Belgium has done. Look at what's happened all the way across the continent. Rather than letting that happen, in Greece, you have to text where you're going to go to be able to even walk outdoors. But in the United States, we're dropping like flies, and government's just going, be careful. I mean, I don't understand it.
I agree with you. I agree with you, and I've been saying for some time that just saying masking and washing hands is not nearly enough. At the same time, we want to do what really is going to make it have an impact. And I think the European experience is a very important one. I think the experience we see in Asia with Australia, New Zealand, other democracies where they have taken this very comprehensive approach. But let me give you an example in Australia. Why were they successful? They paid people to get tested. Yeah. They paid people to stay home. They paid people to be part of the solution. And you know what? It worked. And they knocked it down. Until we understand that, it's going to be a problem for us.
Michael Osterholm, wish you all the best on behalf of all of us who don't want it.
Thank you.
Thank you. Thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.